RingaDoc, connecting doctors and patients. People are walking around with their phone in hands, always checking and glancing at it. For healthcare, this is a way to increase engagement with patients. RingaDoc on-demand service and app that lets people reach a doctor at any time has facilitated more than 100,000 after-hours patients calls to physicians. The software-based solution seeks to simplify after-hour communication between patients and doctors by automatically answering patients' calls and alerting on-call doctors efficiently and swiftly of patients' needs. According to Freud, any product or service offers needs to focus on the accessibility, the conveniences, and also how it is affordable for any customer. That is known as the disruptive innovative theory. The overview of RingaDoc. Jordan Michaels and his business partner, Dr. David Gonin, were the founders of RingaDoc. Jordan is the CEO and co-founder of RingaDoc, the first telemedicine platform capable of instantly connecting patients to physicians. Jordan became interested in health tech after seeing the many pitfalls facing the future of healthcare while working at the USC Medical School in Cedars. Micah is the product manager and co-founder of RingaDoc. Under Micah's leadership, RingaDoc has launched multiple innovative and disruptive products that have dramatically improved doctor-patient communication. RingaDoc provides instant audio and video consultation with doctors, with Americans facing an escalation of shortage of primary care physicians. It is becoming increasingly difficult for patients to get medical attention when they need it. Primary care physicians are now making them more scalable, accessible, and efficient by legitimizing the cross-coverage care and they're already providing today through our network. RingaDoc is transforming the way doctors communicate virtually with patients. The company provides cross-platform communication software for healthcare professionals, their patients, office staff, and cross-coverage providers. Leveraging existing technology and natural behavior, RingaDoc brings doctors and patients closer than ever while making the lives of healthcare professionals easier. The process of RingaDoc. They simply call their doctor's office and leaving them a message, which is delivered directly to the doctor's mobile app and allows the doctor to instantly connect to speak with the patient with the click of a button. For the convenience of on-demand access, patients pay a small fee of around $40, similar to a standard insurance copay for an office visit, and significantly less expensive than a trip to the urgent care. Patients can pay with their flexible spending account, health saving account, or major credit card. Some of the threats that are faced through RingaDoc. The first threat is mobile devices are ambiguous in today's society, and the number and types of devices used by physicians, nurses, clinicians, specialists, administrators, and staff, as well as patients and visitors, is growing at healthcare organizations across the country. Providing anywhere, anytime network access is essential, particularly when instant communication is required to ensure quality patient care. But these devices are launched daily with upgraded versions of operating systems that are ripe for infection. There are also viruses through social media that even healthcare users are not immune to. This means that in spite of the host of malware that can spread through like wildfire through social media sites, it may be virtually impossible to permanently block access to social media at accesses that people use through RingaDoc. The stealing of information. We cannot control the misuse of information through RingaDoc. Misuse and stealing of information in the healthcare industry is because of the amount of people who get jobs in industry for the sole purpose of infiltrating the system and gaining access to patient health information. They will steal these information to gain access to money or in order to commit fraud. Partnership with existing health organizations. Improve quality and consistency. Automation tools are not subject to human error or fatigue, so they can help provide a consistent basis of care activities. The greater automation in the areas of medical records, order entry, and decision support appear to result in reduction in deaths, complication, and cost. Increase predictability of outcomes. When patients follow a standardized care path supported by automation, it is more likely they will stay on track towards predicted outcomes. Additionally, automation can help detect when a patient has deviated from the recommended care plan so the care team can intervene. Triaging. Through RingaDoc, the doctors can triage their patient through mobile devices before they respond to what the situation is. Data-driven insight. Technology used to automate processes can also deliver a wealth of data in a continuous feedback loop that can be used for performance improvement and optimization. With every cycle, an automation system can collect data on how the process is working and use that information to improve the program. This way, it improves on itself over time, becoming even more efficient, more accurate, and more helpful to the workload that is presented. And lastly is Practice Fusion. RingaDoc has announced that their marketing partnership is with Practice Fusion, giving telemedicine providers the EMR developer common ground to expand their growing business. In conclusion, it is hard to predict what will be the ultimate benefit for patients or doctors from technologies like RingaDoc, but at the very least, patients can take solace in the fact that answers to their questions via a physician are just one phone call away. Technology will continue to advance, and communication between doctors and patients will improve. Technological advancement and the delivery of patient care continue to help patients be the drivers in the way they manage their health. Healthy patients remain the goal, along with access to the necessary care at the appropriate time. And the cost for consultation is less than the medical bills that you or any patients will get as they visit the ER or wait for an appointment through their health